I think it kind of stinks that we have to spend every weekend fighting for things that our government won't do for us, rather than being with our families and our loved ones. But I just want to say, having just driven 17 hours to be here today, there's no other place I'd rather be than with you all, standing up for those that don't have a voice in our society. I had come with some written remarks, but I basically just threw it all away because I really want to speak from the heart right now. You know, just about a week ago, we started to feel like we were in the clear, and then all of a sudden we started to see this Delta variant of the coronavirus start to ravage our communities once again. We're being asked to wear masks and socially distance ourselves. And so I started to think about the number of people who we lost to this awful pandemic. Over 610,000 people here in the United States, and close to 65,000 people here in California. And what's really sad about that is 1 out of 3 people that has died were uninsured. And 40% of people that have been infected were uninsured as well. So if there was ever sort of a description of how our broken, immoral healthcare system really comes to fruition, all we have to do is look back on the last year and a half. And I hope we'll keep these people in our thoughts as we fight forward. The other thing I just want to say is prior to the pandemic, we were told, oh, your employer-sponsored healthcare was the best healthcare in the world. And what did we have happen? 27 million people here in the United States lost their employer-sponsored health care. Nearly 2.7 million people here in the state of California. So all of these lies that people have been telling us over and over again have been exposed during this pandemic. We still have 1 out of 3 people that has insurance that won't go see a doctor because their co-pays and deductibles are too expensive. We have millions of people that each year have to struggle between paying their rent or paying for their medication. And frankly, this is not the type of system that we deserve. It's certainly not the type of system we're paying for. You know, 68 cents of every healthcare dollar that's spent in the United States is paid for by us, the taxpayers. Whether it's giving tax credits to Apple or Google, or providing health insurance to our teachers, or firefighters, or our do-nothing Congress. But what we do know is between that and the amount of money that the parasites take from our healthcare system, the insurance industry, the pharmaceutical industry, at our expense, we're paying for a universal healthcare system, we're just not getting it. So this is why we have to continue to organize. We have to continue to push our elected officials. Many of the great ones are here who stand with us. But the fact that California is supposed to be this progressive state and we don't have a clear supermajority of people that support Medicare for all says something about who they serve. They're not serving us, and we need to make sure they stand up for us. And finally, I'll just say this, between Congress and our state legislature, one place we should be able to get single-payer health care is in the state of California. And we can show the country how this will work. And AB 1400 is a great starting point, and that's what we need to get the governor behind. And I would ask each and every one of you, don't give up this fight. Some of us have been in this for 10, 20 years, and it's starting to change. At some point, they can't ignore us, and I hope some of you will stand up and run against these people and make sure that they don't have their office for granted. Thank you very much.
Give it up one more time for Dr. Song! All right, y'all. We having a good time out here fighting for health care? Let's do a little chant. When I say Medicare, you say for all. Medicare! Medicare! All right, folks, coming up next, we have another fabulous speaker. We have Gina Harris. Gina is a nursivist, which if you don't know what that is a nurse and an activist, and has worked as an RN in multiple clinical settings, including med-surg, cardiac rehab, and acute dialysis transplants. Currently, she is inpatient clinical case manager, facilitating the coordination of patient services across the continuum of healthcare needs. This role has allowed her to see that our healthcare system is fundamentally flawed, and why small reform just won't do. Trust me, reform does not work. Gina represents the 54th Assembly District as a member of the LA County and State Democratic Central Committee, has been a DNC delegate for Bernie Sanders in 2016 and 2020, and is a member of the Healthcare for All Los Angeles leadership team. Give it up for Gina Harris!
bullshit. So imagine, you finally got approved for a procedure. You've been waiting for months for it. You finally got approved for it. You come to this fancy tertiary hospital. You have that procedure done. You've been discharged, and they come to you and say the medication you need for the aftercare of this procedure is $1,900. And you must have this medication. There is no alternative. What do? That happened yesterday. Yesterday, that happened to a patient here in Los Angeles where they could not pay that copay for a medication that they needed. They had to have their family put together multiple credit cards to cover that medication. That happened yesterday, and they had a PPO insurance. Now, where in the hell does that work? That is not a good system that works. So we need Medicare for all nationally, but even here we have CalCare ready to go. CalCare is ready, sitting in the assembly, ready to go. We just need to say yes. I want CalCare. What do you guys want? CalCare. What do you guys want? CalCare. Thank you. It's that simple. We just want CalCare. I don't want to have people have to not pay their co-pays to get the care that they need, because why? That's more expensive for them to come back to the hospital. Hello, somebody, in the words of the great Nina Turner. I mean, hello. I'm just out here trying to thrive, okay? We should not have to just survive. We should be out here trying to thrive. And we thrive with Medicare for all or CalCare or both. I would take both. You guys, I'm Gina. Catch me on CalCare office hours on Sundays through Healthcare for All Los Angeles Facebook page. I love you all. Continue to spread love and light, and continue to spread the word about Medicare for All, AB 1400 here in California. Thank you guys.
Give it up one more time for Gina Harris! Yes, all right, folks, we have some more fabulous speakers coming your way. In fact, coming up next, we have a California State Assembly member here to speak with us. We've got Ash Kalra, who is a long-standing supporter of a state-based Medicare for all healthcare system. The Assembly member recognizes the inherent failures and inequities in our current healthcare system, which were exposed further by the COVID-19 pandemic. He recognizes how our profit-first system is failing people of color and underserved communities who disproportionately paid with their lives due to unchecked pre-existing medical conditions. Witnessing this devastation, Assemblymember Kalra stepped up and introduced AB 1400, state legislation also known as CalCare. CalCare will guarantee all Californians comprehensive, high-quality health care. Please welcome the champion of California's Medicare for All bill, AB 1400, Ash Kalra. Thank you, Assembly Member.
All right. Well, I came down from San Jose, in the capital of Silicon Valley, which is also the capital of income inequality, where you see people literally dying on the streets, people losing their homes, many times because they don't have health care. Now, in this state, the 5th wealthiest state in the nation, it's completely inexcusable that we have people dying because they don't have health care, that we have people living in the streets, that we have so much wealth being created. In fact, it just came out a week or two ago, my hometown of San Jose has more super millionaires living there than any other city in the world. That means people worth over $70 million. And yet, we can't get everybody health care. We have billionaires going to space. And yet there are billions on Earth living in poverty. And so the question is, what are we going to do about it? What are we willing to do about it? Because this is not a new issue. This is an issue that people before us have been fighting for decades. As we've seen more and more countries over the decades recognize that healthcare is a human right, not just by words, but by policy and by action. And it's not just about access to healthcare. You know, I can have someone selling Lamborghinis giving me his business card. Well, I guess that means I have access to a Lamborghini, right? My bank account doesn't say I do. So you can have health insurance if you can't afford your copays, you can't afford deductibles. Why do you think so many people, even with health insurance, have to start GoFundMe accounts? It is completely unconscionable. The reality is that single-payer healthcare is both fiscally and morally superior to what we have now. It makes way more sense in terms of dollars and cents, and more importantly, morally. It's about treating every single human being with dignity. It's not just about saying healthcare is a human right, it's meaning it. It's meaning it. And so we have AB 1400, which is an incredibly sound policy. An incredibly sound policy on healthcare. If you haven't seen it, check it out. Been working very closely with our nurses on this. It's got cost containment. It's got everything you would need to make sure that any one of you or your loved ones would be taken care of. Now, we know we're right on the policy. We know we're right on the finances. Now, we have to do right by all of you and make sure we get this passed. But it doesn't get passed because of any one of us. Even though my name's on the bill, even though earlier today, some of you heard from Assemblyman Miguel Santiago, his name is on the bill. My colleague who's going to be here any moment, Assemblyman Wendy Carrillo, her name's on the bill, and Senator Kamlager, who's going to be speaking in a moment. So we have some great champions in the legislature. The reality is, though, that it's going to take all of us. And so even around the country, they're having these great rallies and marches. And I'm excited to be here. I know in San Francisco they have one as well. And I see like online and social media, people are like arguing about this, that, and the other, and this person's speaking, this person's not speaking. We got to stop all that. I could care less. I could care less who's speaking with me on the stage, because I don't care about that. I care about the people that aren't here, that are suffering every single day. We are here to lift them up. We're not here to lift ourselves up. This is not about any one of us. We've got to put our ego aside. Because I'll tell you this, if we don't put our ego aside and we keep fighting with each other, the insurance companies and the hospitals and pharmaceuticals, they don't have to lift a finger. We're defeating ourselves. So let's lead with love and justice and recognize we're going up against very powerful, wealthy interests. But if we lead with love and justice, and we reach out to our neighbors and our communities, we reach out to our elected officials with love in our hearts, with justice on our lips, and we speak truth, I believe that we can make this happen. Because I believe in all of you, I believe in us, and I believe that we can win. Do you believe that we can win? Okay. If you believe that we can win, I want to hear you say, I believe that we can win. 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 Are you ready to win? Are you ready to fight every day until January? That's when the bill comes back. Are we ready for January? Look, it's almost August, so we got to get going. Today is the first day. Right now, we have to get out there, educate the community, activate our community, always with love in our hearts, always with justice in our minds. And let's make this happen. I love you all. Thank you.
Give it up one more time for California State Assembly Member Ash Kalra. Yes, and do not forget, when you see it on the ballot, you had better vote for AB 1400 because we need Medicare for all. If it's not going to be on the federal level, it sure as hell is going to be on the state level. And as you and I both know, California is often the leader in this nation. We do something, everybody else follows. So let's get health care. All right, folks, coming up next, we have actually a California State Senator. Senator Sidney Kamlager represents the 30th Senate District. Senator Kamlager, along with her colleagues Ash Kalra and Wendy Carrillo, is the co-author of AB 1400 CalCare, the California Guaranteed Health Care Act. The senator has spent her career prioritizing equity and access for Californians, especially Angelenos. She has authored landmark legislation in the areas of criminal justice reform, healthcare equity, environmental protections, and affordable housing. including the most transformative probation reform law in the country and legislation requiring implicit bias training for healthcare professionals. Put your hands together for California State Senator Sidley Kamlager. Thank you so much for being with us, Senator.
How y'all doing out here? That was not great. How are y'all doing out here? All right, we are in the heart of La La Land, the heart of Hollywood, talking about healthcare for all. That is what we should be doing each and every single day. You know, I co-authored AB 14 because I thought this is going to be a simple bill. This makes a lot of sense. Everybody should have access to health care. Right now, our system, it costs